Welcome back. Thank you for staying with us. This is Good Morning Kenya, and right now we have gotten into our health segment, and today on health we are talking about immunization. This week having been the World Immunization Week, and it is a week that is celebrated annually on the last week of April. This year it was celebrated from the 24th to today, which is the 30th. It is only right for us to have a conversation on immunization, and joining me in studio to talk about this topic is Terry Mutua. Terry Mutua is a nurse midwife, sub-county public health nurse, Westlands. Terry,
thank you,
welcome
Vivian.
to Good Morning Kenya.
Thank you for having me here. My name is Terry Mutua. I'm a nurse midwife, the sub-county public health nurse, Westlands, where I team lead the nursing services in Westlands sub-county. I coordinate at a key factor that we call the RAMCA, that is Reproductive Maternal Unit, Child and Adolescent Health, and EPI, where immunization falls. EPI is the expanded program on immunization. Thank you for having me here so that we can talk about immunization.
Yes. So it is the World Immunization Week.
Yes.
Today is actually the final day of the Immunization Week. If you can just tell us a bit of the significance behind, this particular week that is celebrated annually.
So we've been celebrating this Immunization Week, where today we are coming to a climax of the activities that we've been carrying out in Nairobi County. Immunization, generally, we want to reach every child outside there. We want to create awareness. We want our mothers to understand why every child below 5 years should get vaccination. So this is a climax of a week that we've been celebrating in Nairobi County, with our theme being humanly possible, saving every life through immunization, and celebrating EPI, that is expanded program on immunization, at 50. So our main focus was to go outside there in the community through outreaches, through inreaches, creating awareness through promotion officers, and ensuring that every client gets the information and they understand the importance of coming to the facilities for immunization.
All right. For someone who is watching us right now and maybe they may not be understanding what exactly immunization is, so if you can just give us a brief definition on what immunization is.
Thank you, Vivian. Again, I wish to let our clients know that immunization is like you want to activate the soldiers of the body. You are being given a vaccine so that your body has the immunity to fight against immunizable diseases. We have a number of immunizable diseases, and just to mention a few of them, like tuberculosis, poliomyelitis, we want to ensure that our clients understand the importance. So when you get a vaccine, it triggers the body immunity so that you are protected. You have the immunity to protect and to fight against specific diseases. Yes.
What vaccines are given to children below the age of 5?
We have a good number of vaccines that are available within our health setup. And remember, these vaccines are controlled by our Ministry of Health. They are free in our government facilities, and we start immediately a child is born. You are given the oral polio vaccine to prevent the poliomyelitis. You are given a vaccine we call BCG. When you're given those within the first 1 week of birth, then you come for now the other routine immunization, whereby within a span of 4 weeks, 6 weeks, 10 and 14 weeks, we have other vaccines like measles, we have other vaccines like injection polio virus, we have the rotavirus, we have other vaccines like pentavalent. Pentavalent contains 5 of them. It is one injectable but containing 5, so it prevents against pertussis, Haemophilus influenza, hepatitis B. Generally, it is a we call it a pentavirus, 5 in 1. Yes. So we ensure that within a span of at least from the time the child is born up to 5 years, there are a number of vaccines that this child is given, and they are all stipulated within the mother booklet. So mothers are meant to understand all these vaccines that a child should be given within a time span of 5 years. And remember, there's also vitamin A that is also given to the babies to boost their immunity. And we have other vaccines like vaccines that are given to adolescents, young girls at the age of 10 to 14 years to prevent the cancer of the cervix. Those are the HPV vaccines. We have other vaccines that are being given to the communities maybe that are endemic with malaria. It's not in Nairobi, but you go to places like Kisumu, you have malaria vaccines. Then we have other vaccines for the travelers, those people that are going outside the country, like the yellow fever. So these vaccines are available within our setup, they are available within our facilities, and they are free. So mothers should understand the importance of why they should come to the facilities, come get the vaccinations of their babies, the under 5, and the other community, like the girls, the HPV, the importance of why we are doing prevention measures. And remember how these vaccines are free. They are supplied
free of charge.
Free of charge. We don't charge them in our facilities.
That's every facility, every public facility?
Every public facility within Nairobi, within Kenya, these vaccines are free. Yes, yes.
Are they safe? Or just how safe are these vaccines, and how do you confirm that they are safe?
Remember, these are government-supplied vaccines. So anything that is coming to be given to the common mwananchi must have been tested through the standards and have been proved that it is safe and safe to be used by the Kenyans, and they are controlled by the policies, and that's why we are sure they are safe. Then when they reach us, before they reach us, they are controlled also within what we call the temperatures that they are supposed to be maintained. So within specific temperatures, they are monitored. When they come to our facilities, we keep them in a specific temperatures, +2 to +8, where they are monitored, so that we are giving vaccines are potent. So our vaccines are safe and safe to be consumed by every Kenyan. Yes.
What are some myths and misconceptions around vaccines that you would love to demystify, you know?
Thank you, Vivian. That is very true. In every community, there are things that are spoken, myths and misunderstanding. People maybe don't understand. When you meet, you discuss things that are not true. Like, for example, if you find people talking just maybe when we are giving those vaccines, they are family planning vaccines, you may not be able to conceive, but I want to demystify those myths and say it is not true. The vaccines have been proven, they have gone through a test, they have been proven that they are safe. Yes. So I want to clear the myths and misunderstanding, like whereby maybe a client can come, ask a question like, when my baby is given these vaccines, they may not be able to grow, they may form other infections. So those are what we demystify. Yes.
What are some of the risks of one not getting vaccinated?
Remember, we say these are vaccines that boost our body immunity. So if you are not let's take, for example, you are not given a vaccine, you may be exposed, you get conditions. An example, I'll talk about poliomyelitis. Remember, poliomyelitis is whereby your bones, they weaken, you're not able to walk, like the lower limbs, the upper limbs. So if you're not given, you are exposed to infections. So we want to boost your immunity so that we prevent you now from these immunizable diseases. Another example that I'll give is like, if you're not given PCG, you may end up with TB. Remember what TB can cause? What TB can expose you to? If you're not given, you get the TB disease itself. If you don't get the medication about for the TB, you may even end up dying. So why do we have to lose our clients? Why do we have to lose our babies? Why do we have to lose our community? Lack of understanding. So that's why we insist on mothers. Actually, we talk antenatally. When they're coming for antenatal checkups, we take them through the mother booklet. There's this mother booklet that we give to our mothers. So there's a page specific for immunization. We take them through so that they can understand the importance of all those vaccines antenatally. So when our mothers are delivering, immediately after the delivery, they are aware that these are the vaccines that are supposed to be given to our young babies. In schools, we are also going to the schools because of the HPV, that is the human papilloma virus. We create awareness in schools through our health promotion officers so that our girls in schools, our teachers in school can understand the importance of why the girls should get the HPV. Remember, cancer is killing. Cancer is a stigma in itself. So we say we prevent first. Even before going to other secondary and tertiary, we are doing primary prevention. That is through the HPV vaccination. And it is also free. By the age of 10 years to 14 years, our girls should get at least 2 doses of the HPV vaccination. So we give the first dose with the consent of the parents, of course, then the second dose at 6 months. Yes.
Well, say when a child is sick or on medication, is it still safe for them to receive immunization?
Thank you, Vivian. Again, I'll say yes.
Yeah.
And unless it has been, the child has gone to the doctor or to a medic, somebody qualified, and maybe advises us on a way forward, but they are safe to use. Remember, this person who is sick, this child is sick, the immunity is low. So we want to boost the immunity of this child. So the vaccines are safe to be used even during sickness.
Yeah.
Yes.
And can one get multiple vaccines at the same time? Is it advisable?
When we talk of multiple vaccines at the same time, there is specific age where you find a child is getting maybe 3, not only 1. So at birth, you get the oral polio, you get the BCG.
Yeah.
At 4 weeks, there's a time you will come, you find a child is getting oral polio and at the same time getting the injection. So the penta that has 5 in 1. So it is safe. So you may end up getting the oral ones and you may end up getting the injection. There are times also we can give 2 injections at the same time at the age of 14 weeks. So you find that baby getting on the right thigh, the left thigh, and at the same time they're getting the oral polio. So they are safe to be used. Yeah. They have been tested, they have been proved to be safe for our children. Yes.
Say a kid misses on a vaccination. You know, you've given us, you've spaced it out for us, you know, from this age to this age, from this week, this is what they're supposed to get. Say they miss out, maybe on the 14th week, they miss out on the vaccine that they were supposed to receive at that point. What happens? Can one just come at some other time and still get it? Can a parent still bring them in at some other time to get it? Or what happens when they miss these vaccines at the time that they should get it?
Remember, I said, the first thing that I said, for us to reach every one child, at times we do what we call outreaches. When we go for these outreaches, we find in some community, you know, as we were talking about the myths and misunderstanding, there are some communities who don't maybe see the importance of why the children should come for immunization. So when we go for these outreaches, we find we have kids who've not gotten vaccinations, immunization. So what we do, we encourage them to come back to the facilities. Let's take, for example, the child was delivered 2 weeks ago, or a child was delivered a week before the span of the 14 weeks. This child has not gotten the BCG, the child has not gotten the oral polio vaccine, the child has not gotten the first immunization vaccinations. So what we do, we tell them to come to the facility, we link them to the nearest facility. Then when they come, we review the mother booklet. With the help of the mother, we are able to tell which vaccinations are these that this child has gotten, which are the vaccinations has this child not gotten. So we are able to give according to the age bracket, according to the time this baby gets us in the facility. So with the review of the healthcare personnel, talking to the mother, being assistant with information from the mother, we are able to vaccinate the baby. Yes, so they are safe. They are safe.
So it's still okay
within
even if they get to
a span of
miss.
5 years.
Okay.
So we are able to tell these are the vaccinations that this child has not gotten. So they'll come, we review, then we are able to tell which ones now are they due for immunization. Yes, remember I said the other thing, and very key to us as healthcare professionals, is we have what we call, the people, healthcare professionals, we are calling the CHPs, community health promoters. These are very key people in the community. So they are able to trace these clients from their homesteads, households, they have households, then they refer them to the facilities for vaccination.
All right.
Yes.
What is the impact of immunization generally on public health?
When we talk of impact, how have we reached? How many children have we reached? I want to say today here is we've been able, through activities that have been organized by the Ministry of Health, by the Nairobi County, by the sub-county team, we can say we've reached almost 75% of our children. Remember, we talk of activities outside the facilities. And one of the activities, as I've been talking about, is like outreaches. So it has really made a good impact in the community. Mothers are aware that these vaccinations are being given. Mothers are enlightened antenatally. Mothers are enlightened even before conception, preconception. And remember, these days, we feel encouraged because even the partners are coming to the facilities to bring clients for other services. So when they come, they are given information, they are enlightened on various services that we're offering in the facilities, and they are able to support one another. And we've made a good impact in reaching every community with the vaccination.
Yeah.
Yes.
Yeah. Maybe, I know you've mentioned about the HPV vaccine. You know, maybe what are some other vaccines that adults can get administered? We have
hepatitis B. We have yellow fever vaccines for those that are traveling. We have malaria vaccine. Malaria vaccine is given to areas that are endemic with malaria. For example, you're in Kisumu. We have the vaccination schedule of the malaria vaccines. So mostly those are vaccines that are eligible for the adults. Yes. But remember, we're also talking of the HPV vaccine. HPV vaccine is not just limited to this age bracket. It wasn't just because of the logistics that were done. So we normally say someone who is even 20 years if they are not sexually active. The eligibility criteria is if you're not sexually active. Remember, we are trying to prevent. So if you're sexually active, it means you'll come, we do a screening. Screening is what we call the cervical cancer screening, where we are using acetic acid in our facilities, and we are able to test, to do the screening immediately and give you the results. So if the results are, maybe you have a positive lesion, we are able to treat there and there, and we are able to link you to our services. So prevention is better than cure. That's why we are doing the prevention part of it. Right? So it doesn't mean whether maybe you are 20 years, you are 18 years, if you are not sexually active, you can get the HPV vaccination. It's only that in our government setups, the logistics that were done limited us from the age of 10 to 14 years. But we are able to give information on where you can get the vaccination. Yes. Yeah.
And the vaccination can be gotten from any
the vaccination, it's within our public facilities. We are giving the age limit of 10 to 14 years. But let's take, for example, a client who comes at the age of 20 and tells you she's not sexually active. We are able to assist these clients even in the private sector. We are the people, we are the government giving these vaccines, even to our private sectors. The only charge that they make is the service charge. So it is also affordable, it is cheap. Yes.
Yeah. Maybe what challenges does the Kenya National Immunization Program face at the moment?
At the moment, we still have areas that we've, maybe accessibility is an issue. We still have to address the issues of myths and misconception. Remember, fund is also a limit. Yeah, where maybe we want to organize for an outreach, we want to reach that everyone's child in the community, but at times you find we don't have funds for outreaches. So we have to depend on donor, we have to depend on partners. So let's take, for example, there's no partner, we go an extra mile to organize for those outreaches. So if we are not able to afford to go outside for the outreaches, we'll always do an in-reach within the facility. So at times it is a challenge for us to go outside there. Now, like a time like now when the areas are flooded, reaching those communities, it's a bit difficult. Yes, but we try our best to ensure that even when in the absence of the partners, we go to the community, we reach that one child with information, we ensure that vaccinations immunization is done to every child in the community. We are not leaving anyone. And these days, we are really supported by the CHPs, who are able to bring the households, those mothers in households who have not gotten the vaccination. Yes.
So those are some of the challenges.
Yes, those are some of the challenges that we are facing.
Yeah.
Yes. And then the other thing maybe we could, I could also address in this forum is maybe staff turnover, and especially in the nursing department. Staff turnover is whereby you go to a facility this month, you do what we call on-job training, you do mentorship to the staffs who are there, maybe new staffs. When you go for supervision, maybe after 3 months, they are not there. Why? Because they have gotten green pastures, and you cannot deny them from moving. So remember, nurses are moving from every country here and there. Yeah. There are so many green pastures for the nurses outside there. So when we do mentorship, when you go again after 3 months, they are not there. So we feel a bit discouraged, because now you need to start afresh and make sure that those people that are working there are well informed. Yeah. Remember, this vaccination is very sensitive. Immunization under 5, very sensitive. So it's something that is going direct to your immune system. So we need to know we are doing the right thing and with the right people, the right people with the right information. Yes.
Maybe how long does it take to get a vaccine, like to develop a vaccine? Is it standard for all vaccines, or it depends?
It is not standard. It is standard. It is, I mean, it is not standard. It depends with different vaccine. So it will take the manufacturer time for a vaccine to be developed. So depending with the vaccine that is being developed, it is different from one vaccine to another. So it is not standard. It's not something like you can say you are doing the same at the same time. So they are different. Yes,
so there are vaccines that can be developed quicker. Because I remember when we had the COVID pandemic, I feel like the vaccine was developed quite quickly.
It was, I can say it was not immediate. You remember we stayed for a while without being promised the COVID vaccination. I think we stayed for some time before us, especially Kenyans, got the vaccines. So it will take some time. It's a process to ensure that standards are met, the right standards are there to the right, it reaches us when it is within its right potent. So it takes time. Yes.
Now, during this World Immunization Week, how have we commemorated it here in the country? You know, what are some of the activities that maybe have taken place throughout the entire week? Because it started on the 24th. That's an entire week ending today. So just how have you been doing your activities, or how have your activities been looking like in that week?
Sorry. Thank you, Vivian. This has been a very busy week. We started by commemorating our immunization week in Lang'ata, Kibra. This is one of the sub-counties in Nairobi. So when we create awareness first, our clients need to understand this is immunization week. Our healthcare personnel also need to understand we are commemorating the health immunization week. We've had a good number of activities in our setups whereby we've been able to do immunization outreaches. We've been able to do enriches. We've been able to create awareness. We have officers that we call health promotion officers. So they have been able to create awareness to the community, giving them the right information. So we've had outreaches, we've had enriches, we've had health talks. We create awareness, we go outside, we take the vaccines to the community, and those are some of the activities that have been going on. And now to climax, we've also been going to the media houses, various media houses actually, both the TV, both the radio stations, to create awareness on immunization. So I don't think we've left any client outside there. We've given the right information. We've even talked to our gatekeepers, like the chiefs, like the community barasas. Community dialogues is whereby a community, we are invited to go and talk immunization. We create awareness even in churches, during the Sundays, in mosques, in SDAs. So we've been able to go to every community with the information. Yes.
Have we created enough awareness on immunization over the years? Do you feel like we've done enough work when it comes to awareness?
In Kenya, I say there's nothing that is enough. Why am I saying this? Maybe you find we have this group of people this time. Next month, they are not with us. They have maybe migrated. So we always continue sensitizing them. So there's no single time that I'll sit as a healthcare worker and say that I'm at 100% enough, that I will not continue working again, that I will not continue creating awareness. So it is continuous. So it means even after here, we still go back and create and continue creating awareness. We say information is power. So when I give you information, you ensure you give the third person. So it goes like that. Yeah.
So it's a continuous
So it is a
job.
continuous process, a continuous process. Today I have this generation, tomorrow I have a new client. The next day I'm in maternity, I have a new mother. The next day I will be having another new mother. So it is a continuous process. So we continue talking. Remember every morning in every setup in a facility, we do what we call health messages. So there's a health care worker who will always have a schedule on the health messages that they're supposed to share with their clients. And when these clients will come to the specific rooms, they're also given the same information. Yes. Yeah.
For communities whereby women still believe in giving birth in their homes, you know, because I'm sure there are still communities that do that, you know, and just how are you working on reaching that mother who, you know, isn't going to any healthcare facility, they're just at home?
It is very true. In this era, we still have mothers giving birth. But as I said, we have community health promoters. Remember, the community health promoters are people from that community. So they understand their community well. They understand their culture well. So we respect cultures, but we ensure that there is no mother who is delivering at home. Why? Remember the risks. This mother will deliver at home. She may end up with complications, and she may end up giving a life. So what we do, we encourage our community health promoters to ensure that they sensitize the community, and in the situation that they are not able to give the right information, or maybe when you are from a specific community, your people may not take you serious. So we encourage them to get to us in the facilities, and we join hands together. So we go to those communities and we ensure that we use even the chiefs, the chiefs, the sub-chiefs, the area elders, for them to ensure that the information is well delivered. This time we have what we call nyumba kumi. So they understand one another, and they ensure that the information is delivered. Yes.
Yeah. Now, what are some of the initiatives or programs that are being planned for, you know, to ensure vaccine coverage and access at the moment?
At the moment, we are doing what we are calling, in our facilities, we are doing capacity building to our staffs to ensure that every staff is aware on vaccination schedules and on the immunizations that are introduced in the government sector. Then we are doing what we call, I've been talking about the outreaches, inreaches, going to the community. We have the CHPs, we've been training them, they understand the importance of immunization. We enlighten the community through the chief barasas, the community dialogues, and the government has really supported us in this, to go outside and ensure that everyone has information.
Yeah.
Yeah.
Yeah. Maybe what are some of the emerging trends as well in the field of immunization? Are there emerging trends?
Like whereby maybe we've not reached in a community, let's say for example, you go in a community where you've not been able to reach with vaccinations, maybe you find some specific cases like when we go outside with the polio vaccination, you find in those households, maybe there is a child who had not gotten the vaccinations. So in such a trend is where by now we encourage them now to come to the facilities. Yes.
Yeah. Okay. My question on that was, what are the developments? Are there any new developments when it comes to immunization?
Right now we have the vaccinations that we have, we've not had the new ones, apart from the HPV that has been introduced. These others are the schedules that we've been continuing with from the time of birth to the time of 5 years. We've not introduced the new vaccines. Apart from the HPV, then we have also the yellow fever. Those are for the travelers, and the malaria vaccines for the endemic areas. Yes. Yeah. And of course, the COVID vaccination, it is still ongoing. I know there's those that have not gotten even the first jab of the COVID vaccines.
Yeah.
Remember, we are giving COVID vaccination. We said the pandemic could be over, but the disease is still with us. The disease is still with us. The COVID disease is still with us. So I still encourage those that have not gotten the COVID vaccinations still to come to our setups, to our facilities. It is still with us. And it is good. Remember, when you get these vaccines, we said it's like a soldier within your system. So it fights for you to boost your immunity. So remember when you are protected, when you have a soldier around you, how do you feel?
Feel safer.
You feel safe. You feel protected. And that's why you find majority of us healthcare professionals, these days we are too safe. We are good to move. We are safe. Because we've gotten COVID vaccinations, our immunity is well protected, and we can stand and move forward and continue with our daily activities. Yes.
So the COVID vaccinations are still being given in healthcare facilities. Someone can just, can just walk in and request for a COVID vaccination?
As we talk now, we are in Westlands sub-county. Westlands sub-county, we have a number of public facilities, that's 6 public facilities, and one of them is just behind us here, which is Westlands Hospital. Just walk in there, get a COVID vaccination. Walk to Kangemi, you will get COVID vaccinations. Walk to Karura, walk to Lower Kabete, walk to Mujiwa Uruma. Those are the facilities. Walk to the Gishagi Mountain View. You'll be able to get the COVID vaccinations, and it is free. Within 5 minutes, you will have gotten your jab and documentation will be done. Yes. And remember, this documentation is online. So you are able to see yourself, you are able to retrieve your certificate of COVID vaccination online. Yes.
One may be asking, why do I need that vaccination and COVID is no longer here with us?
Exactly. Remember how I started saying COVID pandemic, a disease, people think it is, as a pandemic, it's over. But the disease is still with us. People are still coming tested for COVID, and it turns to be positive. So it is a condition that still remains. It is with us. So we need to protect ourselves and protect ourselves very well. So people need to understand the importance of why they should get the COVID vaccination, because the disease still exists, it's still with us. Yeah. Yes.
Do you still have cases of COVID, maybe?
Yes, we still have cases of
your
COVID
facilities,
in our facilities. They walk in, they are tested, they are positive for COVID. And when you take history from these clients, these are clients, a majority of them, they even had not gotten the first jab. So what are we talking about? COVID is still with us. So let's get the COVID vaccinations. Let's be vaccinated. Yes. Yeah.
All right. So maybe if we may just go through the risks of not getting vaccination, specifically for younger children, you know, the vaccines that are very crucial that you've just mentioned, from conception, from rather one being having been birthed to 5 years of age. Just what are the risks? What if you don't take your child for immunization? What are you putting them at risk for?
Thank you, Vivian. Remember, we said vaccinations, you are given immunization to boost your immunity. I will give an example just a few minutes ago. Immunizations are like soldiers, they are protecting you in your body. So what happens, generally, even in a layman language, if you're not given vaccination, you end up, you are not protected. Your immunity goes low. So if you get slight infection, it means your body is not able to protect you against the immunizable diseases. So you end up with low immunity. And when you end up with low immunity, if you are not able maybe even to reach the facility within the specific given time, what can happen? You may end up even dying, right? Yeah. Because your body is not able to protect you against the disease. So the disease is there. It is just fighting you. But you don't have the soldiers to protect you. So what happens? You end up, your immunity is down, get the disease, and you die. It is that serious. Yes. So our clients need to understand the importance of why our babies should get vaccination. It is mothers should understand. I say mothers because you find they are the ones bringing the babies to the facility. In a rare case, you find them being accompanied by the partners. But in most cases, it's the mothers that we have, right? So they need to understand. And that's why we said they need to understand preconception before even this mother gets the pregnancy. Preconception, conception. During antenatal, we still sing the same song about immunization. And during delivery, even before this mother leaves the facility, I said immediately the baby is born, we'll get the first oral polio vaccine and get the BCG vaccine to prevent other tuberculosis.
All right.
So that's the essence of why they shouldn't, because it will just be leading you to death. You don't have immunity. You cough, you cough, you cough. No immunity, no immunity. Remember, these are young, they're still immature, they're still growing. So for them to grow, they need to be boosted with immunity. Yes.
All right. We'll take a short break. Don't you go too far. We'll be back to continue with this conversation. Welcome back. This is Good Morning Kenya, and the segment on air is Health Tuesday. And today we were talking about immunization, this being the last day of the World Immunization Week. And we have Terry in studio, and she's just taken us through immunization as a topic and just the risks that you may be putting your child through if you do not avail them for these different vaccines that they should get by age 5. Now, Terry, what is the vision, for the country matters immunization, say, by the year 2030, which is only how many years from now? Just 6 years from now. Less than 6 years, actually, because we are almost coming to mid this 2024. So what's the vision? Where are we seeing ourselves as a country matters immunization?
Thank you, Vivian. As a country, matters pertaining immunization, we sleep a dream whereby there's no child who is left out. So our vision is reaching every child with immunization by 2030, ensuring that every community, every mother, every client understands the importance of why every child should have immunization. So we will not have, we wish to dream where we will not have cases of children who have not been immunized, children who are left out, communities that don't understand the importance of immunization, and that's our goal, that's our vision.
Is it possible to get to that goal?
Yes, it is possible. It is. With good teamwork, working together, we are able to reach those communities. We are able to reach every client with immunization. We want to ensure that every girl at the age of 10 to 14 years get the HPV vaccination, primary prevention, where we don't have our mothers dying in the wards. Remember, I said cervical cancer is also very stigmatized. You are left out. You are in a world of yourself. So we want to prevent before we reach to the secondary prevention and tertiary prevention. So prevention, we start with HPV vaccination as a primary prevention. So it is also our goal. It is also our vision. We are looking for 6 years to come right now. Every girl 10 to 14 years should have been vaccinated on cervical cancer with HPV vaccination. Yes.
Who should jump on board on this fight to ensure that by the year 2030, maybe every girl between that age will have received the vaccine, the HPV vaccination, as well as just ensuring that by that year, our vaccination game will be, let me say, on top in terms of, there's no child who's being left behind?
Who should jump on board? It is me and you, Vivian. Why am I saying this? We have the information. So this information should reach every Kenyan, right? So it is us sharing information, enlightening one another, ensuring that you have a sister, you have a brother, you have an aunt, you have a client, you have someone, you have a friend. Let them get this information this day to day. Let them understand the importance of us coming together as a team. As a healthcare professionals alone, we cannot make it. We cannot achieve alone. So we need to come together as all sectors education, which other ministry, all the ministries need to come together and create awareness in their departments and ensure that this information reaches every community so that they can understand the importance of immunization. So we need to team up. Otherwise, Ministry of Health alone cannot. So we need to multi-sector with other teams, other sectors, and other teams. Religious leaders need to assist us. Why am I saying this? Religious leaders, we know we get information from our religious leaders, and we trust them. So it is good when also information is given to their members in the churches so that they can also understand the importance of vaccination. So I talk saying we need to come together as a team. We need to work together and ensure that we reach every community. Yes.
So everyone has a responsibility.
Everyone has a responsibility, including Vivian. So today, make sure you've given information at least to 10 people. Refer 10 people to me in Westlands. Refer 10 girls to me in Westlands. They come for HPV vaccination. Refer 10 mothers to me in Westlands for CA screening, cervical cancer screening. And maybe to probe it out, we start with ourselves. Have you been screened? That's the question you are supposed to ask yourself. So if you ask yourself that question, if you've not undergone cervical cancer screening, maybe for the last 5 years, you've never been screened, what are you waiting for? Why can't you come to the facility? We screen you for the cervical. It is, remember we say cancer is manageable, cancer is treatable when detected early. But when you leave the virus to take care of your body, well, you know what, you understand what happens.
Yeah.
So it is good you do it early, and you do it early. And I insist our public facilities, all these services are free. You get them free. So there is no question as to why you are not coming to the facility. It's not about money. I would say maybe it is ignorance. Because you understand the facilities, the services are free. Everything is free. Within a span of a few minutes, you will be done. Yes, and you will have known your status.
Yeah.
Right?
Yeah.
Yes.
Yeah, I'm getting that you're really pushing on the cervical cancer vaccine. Is that something that you are really on the ground on right now?
Remember, during my introduction, I said I team lead the nursing services.
Yeah.
I coordinate an indicator that we call reproductive maternal unit and adolescent child health, and expanded program on immunization within Westlands sub-county. So what am I saying? I'm selling something that I'm a partaker of. I give the services right on the ground. So I understand when I talk of come for cervical cancer screening, it's something that if a client gets me there in Westlands sub-county, in Westlands Hospital, I'm able to walk in the room with the client personally and do the screening. And I'm able to help that one, so yes, yeah.
All right, Madam Terry, thank you so much for joining us for this conversation. Maybe you may give your parting shots if there's something you feel is burning that you want to talk about.
What I feel, not burning as such, but I always have that passion on Ramka. So I tell my clients, please don't sit outside there asking where can I get the information, where can I get the services, who can assist me. We are there, we are hands-on to assist every client. So within Westlands sub-county, I said it's one of the sub-counties in Nairobi, I'm able to refer you to our public facilities. And I'll mention them by name. I'll start with Westlands Hospital, I'll go to Kangemi Health Center, I'll go to Gishagi Health Center, I'll go to Lower Kabete, I'll go to Mutua Uruma and Karura Health Center. So those are public facilities within Westlands sub-county. But not to mention, I have other private facilities. And we are blessed in Westlands sub-county because we have the giant private facilities, like Aga Khan, like Avenue, like Mpisha. Those are facilities that you'll walk also and get any other service that you require. But we have clients, maybe they don't have the medical cover, and I will insist on the clients, maybe those that have not registered themselves on NHIF, let them do so. It assists. But don't sit outside there thinking because I've not registered myself on NHIF, I don't have money, so you are just there waiting to die. No. Please come to our public facilities, and we are hands-on. We'll be able to assist you. You get the information that is required, you make decision and informed decision. Yes.
All right. Thank you so much for joining us for this conversation, and thank you for the work that you're doing and the work that you've been doing specifically within this week of the World Immunization Week.
Thank you, Vivian. Thank you.
All right. Now, this is where we end this particular interview. Remember that we are expecting a live, and that is on the supplement of the laws of Kenya. That should be coming up within no time right here, and we will be keeping you tabs on that.